I am absolutely passionate about this hot topic of medical billing and dentistry. So I want you to imagine for a second that you're sitting at your consult table and Sue's in front of you. She's just gone back for her exam, and you have the privilege of telling her her treatment plan, and you need to tell her her treatment's going to be $10,000. And we verified dental benefits, and they're going to contribute $1,500. So Sue, we need to collect $8,500 from you in order for you to get the treatment that you need. And Sue loses color in her face, and she might slump back in her chair. She may even have tears in her eyes, because Sue came to you because she wanted the treatment that you recommended. Our patients want healthy mouths. Our patients want pain-free chewing. They want beautiful smiles. But Sue doesn't have $8,500, right? We've all been there. So now imagine this. Sue, it's okay. Don't worry, no tears. Because you came to my office and we bill medical insurance, I was able to get them to authorize your treatment. And even with your deductible, your portion's only going to be about $2,500. Would that be a more affordable option for you? And we all know the answer is yes. Our patients could afford $2,500 far easier than they can $8,500. That is what medical billing can do. If we can decrease your patient portion, we can increase case acceptance. When we increase case acceptance, we get patients the care that they need. You will not hear me stand up here and talk about the ROI of medical billing. I will not guarantee you that every dentist will make another $100,000 per year by adding this service. But what I can tell you is that if you can reduce your patient portion by adding this new payment source, you can increase case acceptance and help your patients get the treatment you need, which will fill your schedule. So hopefully you're all thinking, I want to do that. I want to help those patients. I want to schedule those appointments. I want to be that kind of practice. And you're probably asking yourself, what can I bill for? What are my options here? What was Sue's treatment plan? How did you do that? So first of all, I have to start by saying every single procedure we do in dentistry is billable to dental insurance. Every single one, if we can prove medical necessity. So I use a statement often, it's not about what you're doing, it's about why you're doing it. So it's not about the treatment plan, it's not the ADA code. It's why did they need it? What was the reason? If we can prove medical necessity and prove that there was a medical correlation for this treatment, we can get coverage for our patient. So that also means I'm saying that every single dentist in the country is doing one or more procedures that could be billed to medical insurance. So I usually talk about medical billing for a minimum of 2 days, and I barely cover the surface. So how was I going to do this in less than 10 minutes and create enough excitement and value for you that you wanted to learn more? So I decided to pick the top 5 procedures or categories that are often covered by medical insurance. So the first one I picked was bone grafting. And I did that for a couple of reasons. One, it's fairly easy to bill. So there's not a lot of codes to choose from. It's also fairly easy to prove medical necessity because we're treating atrophy. And you can't say the word atrophy and not think medical, right? It's also not commonly covered by dental insurance. So if you're doing a lot of bone grafting, you're probably having to collect a lot of out-of-pocket portion from your patient, right? The other thing about bone that I think is worth noting is the allowable is considerably higher than that of medical. So your allowables on bone and your PPO fee schedules, if you happen to be a practice who takes dental insurance, might be lower than you wish, right? That happens a little bit in PPO fee schedules. When you bill medical insurance, you actually get to bill your full UCR because you'll likely be non-participating. So we not only get our patients reimbursement, but we actually get to bill a higher fee with a higher allowable. So bone's a fantastic place to start. My second is implants, and I chose it for many of the same reasons. It's fairly easy to code. There's not a ton of codes to choose from. When you can prove medical necessity, you do get great coverage. But I really need you to listen to me on this one. So listen to what I say, not what you want to hear. Not all implants are covered by dental or medical insurance, okay? They're just not. So Some plans don't cover them. Sometimes even when we make the best case in the world, then we find ourselves unable to have coverage because the plan excludes them. So we can't change coverage, for the plan coverage. We can't control that. We do our best, we prove medical necessity, and we do get coverage on a lot of cases. But I hope, again, you listen to what I said and not what you wanted to hear. Just because you're placing implants does not mean they're going to be covered by medical insurance. The other reason I picked implants is because of the cost associated with them. They're a fairly high-priced procedure. Let's say you do get dental benefits for your implant. You just used your patient's entire annual max on a single tooth. How many of your patients need one tooth restored? Very few. So what I'm going to suggest you do is bill medical insurance for the higher priced procedure, the implant, and let's leave those precious dental benefits for your restorative treatment and your basic treatment, so we get the patient the best of both worlds. Now, my third category is one of my favorite topics in dentistry, and it is sleep apnea. So I chose billing oral appliances to medical insurance because, one, they are one of the easiest procedures to bill for. And many of you who have attempted this might be thinking she's crazy. No, they're not. They are, okay? One procedure code, one diagnosis code. If you have the proper documentation, medical insurance is paying for sleep appliances. Dental insurance doesn't pay for them. So if you're not billing medical insurance, then what payment options are your patients going to have? And the answer is none. They're going to be paying out of pocket entirely for these oral appliances. The other thing about sleep is there is a fantastic ROI on sleep appliances. The allowables are great. Your lab fees and your cost to do business can be very affordable, and you can really, really generate some fantastic revenue. But I hope you're doing it because sleep changes lives, and you have an opportunity to do this for your patients and really change the lives of every patient in your practice that you can screen and effectively treat. So when I advance tomorrow to the finalists, I'll be talking a little bit more on sleep and why I'm so passionate about it. My fourth category is a little bit easier. It is radiographs. And I chose it because every dentist in the country, well, I shouldn't say that, most dentists in the country are taking x-rays on their patients. But did you know that medical insurance is paying for both 2D and 3D imaging if you're taking the image for a medical reason? So if the patient is presenting with pain, if they have infection, if they have missing teeth and you're looking at atrophy, or maybe you're even planning for a covered surgical procedure, they will actually pay for your panos, your bite wings, your PAs. Then CBCTs. I'm a huge fan of cone beam technology. I think it should be the standard of care. Dental insurances that are covering them aren't allowing enough to even make it make sense. So I have all these customers who have invested in this technology and are either not using it, it's collecting dust, they're charging a ridiculously low fee because that's what's allowed, or they're downgrading it and using it only for panos. So if you have considered investing in CBCT, or you've already invested and you're maybe frustrated with your ROI, definitely look at medical billing as a possibility. And then my fifth category is accidents. And I love dental accidents. But I don't mean that in a way that sounds quite so evil. I never like to see our patients present with that tooth in their hand, but it happens, right? We've all seen it. What you need to know about accidents is it doesn't take a police report or an ER visit or a referral. You can actually bill for an accident just when someone was hit by the knee on the trampoline, okay? Now I want to share with you a story about why I'm so passionate about medical billing. A patient came in to me. He was referred by a local surgeon, and his name was John. He had fallen while walking and hit the anterior arteries, and we do an exam, and he has non-restorable teeth. He needs an implant-supported upper and lower denture. So John and his wife, Elaine, sit down in front of me, and I present their treatment to him, and it's over $50,000. And Elaine's got tears in her eyes. John's as pale as a ghost. They don't even know what to do. I said, wait. Because you came to my office and we bill medical insurance, I've already authorized your treatment plan. because you've met your deductible and your out-of-pocket max because of your surgery, they're gonna cover 100% of your procedure. We saved this patient $50,000, got them the best care available, completely changed his life. That's why we do this. I was able to change this patient's life, increase my revenue by $50,000. And I did it because I was willing to do a little bit of paperwork. So I would challenge all of you to ask yourselves, do you have patients like that in your practice? Last month, last quarter, last year, how many patients did you see that could have benefited from you being willing to do a little bit of paperwork? Thank you very much.